Hi, this is Dr. Nami, and today I wanted to start off by sharing with you a couple of patients and all this great work that we do. What's really interesting is that sometimes when you're not in the office or if you don't understand this stuff, you're kind of curious, like, what are they doing there or how does this actually work? So, what I wanted to do was just take a couple of minutes to kind of share with you a couple of my patients of how things have occurred and or how things have improved, which is my favorite way to do that. And I like to share this information because it's work that we've done without antibiotics, without being super invasive, without, using, a lot of toxic products or anything like that. And that makes me very happy. And I get really excited to share this. So what I am going to do in a minute is share my screen and I'm going to start talking to you about a few of my patients that I've really, really, really enjoyed and really seen great results with. So the first person I am going to start off with is going to be Michelle. Michelle is a really beautiful, sweet person. Oh my God, life of the party, really vibrant. Was going with, she was really going to see like a dentist every 6 months and things like that. And then she was like, oh my gosh, my gums will not stop bleeding. I am very uncomfortable. Like, I do not understand why my gums are bleeding, and there's nothing I can do about it. So she was going to the dentist. She was going every 3 months, following her home care routine and really not figuring out what on earth was going on. So she said, Dr. Patel, tell me, what can I do? And so I said, you know what? That's fantastic. I'm delighted you're here. Let's first start you off with a thorough assessment and a oral microbiome report. When I looked in her mouth, she looked pretty great and a couple of spots of bleeding, but nothing too crazy. Like it wasn't like there was a ton of tartar in her mouth or that she hadn't been brushing her teeth or anything like that. So we took a look around. The one thing I did suspect on her was hormonal changes. She's mid 40s, early 50s. So that was something that I did think that was going on. So here we are. We did her oral microbiome report here. And the way we look at this is we actually look at there's green light bacteria, yellow light bacteria, and red light bacteria. So you can see in her case, she had a lot of red light bacteria. Now, what does that mean? So all of these bacteria are pathogenic. They do cause a problem. These are the least toxic, middle toxic, and red toxic. Anytime we find anything in this red zone, we start off directly with like a deep cleaning with laser ozone iodine to remove these bugs because these are really potent. And usually what this means is like you've got them in like a systemic form. These guys are also related to heart attack, diabetes, cancer, ectopic pregnancy. So we really want to make sure that these are gone. Most importantly, this PG is actually causative for Alzheimer's. And so anytime there's anybody with a history of a deep cleaning or history of gum disease at some point in their lives, these snake-like bacteria tend to stick around. And what they do is because they're so small, they cross through the blood-brain barrier. And when they cross through the blood-brain barrier, your body tries to fight it off. And as it fights it off, it actually not only damages, obviously gets rid of the bacteria, but also damages brain cells. And that's what we know over a long period of time as a causative agent for Alzheimer. So we really want to make sure that there is no PG in the mouth whatsoever. And then TDTF, again, are all linked to heart attack, diabetes, cancer. So again, do not want those inside the mouth. But here's the thing that I want to share with you. This is Michelle. This is us checking her out about 6 weeks later or so. We did her deep cleaning with laser ozone iodine. She's coming in for multiple appointments, things like that, and a really thorough assessment. And here you can see this massive 86 percentage of reduction, which is really phenomenal. We completely got rid of the red light bacteria. There is a little bit of the FN. We do want that. And this low potent bacteria, not a concern. We're going to continue to see her every 3 months. We've given her some adjuncts with oral probiotics and some other things that she can do at home to help make sure that these bacteria are gone. But massive results, 86% reduction in bacteria without antibiotics. without invasive procedures. This is just the use of lasers and specific lasers and the technology that we have and the regimen that we do for our patients. And it's been just delightful to be able to work with Michelle and really give her these results. And especially also give her the vote of confidence that she really wants as she's getting older. Going from 40s to 50s is no fun, 50 to 60s is no fun, 60 to 70s is no fun. Every decade, our risk for inflammation increases. And when the risk for inflammation increases, we really want to know with confidence that we're decreasing the bacterial load, decreasing causes of inflammation, and especially red light pathogenic bacteria that are linked to our heart attack, diabetes, cancer, Alzheimer's, arthritis. Some of the major killers that we're really dealing with. And that's really, really critical to look at. So I wanted to share you a little bit about Michelle and, just kind of share with you what we do here and some data-driven results. And, she's been a patient for a number of years now, super happy, great, and still in great condition. We test her every single year to make sure that the bacteria is not returned, and we monitor her with total confidence. So if you would like to check out your own microbiome and get some great results, please give us a call, and I'm looking forward to taking great care of you.